At the Hearing and Balance Institute, we take care of balance patients, and we have all the tools at our disposal to sort out and work out what type of balance issues a patient might have. Balance is a complicated neurological process. There's three parts to our balance system. There's the ears, the eyes, and the skeleton, or the input that we feel in our body when we're moving in space. When a patient comes in and feels dizzy, I try and determine what dizziness means to them, because it's a very non-specific word. I try specifically to determine if they're having vertigo, which is a sensation of motion when you're not really moving. That really helps us narrow it down, because the laundry list of causes for dizziness is about this long, and the vertigo causes are about this long, and the number of things in the ear are about that long, and we try and determine whether it's an ear problem or a brain problem or outside the ear. The tests that we order, VNG, rotary chair, posturography, ABR, electrocochleography, and a hearing test help us get all the information we need about the ear and the way the ear is talking to the brain and the eyes and that whole system, and we can usually hone in quite nicely on what the problem is. There was a patient that I saw once who had been dizzy for years. She would get vertigo anytime she laid back in bed, rolled over in bed, and she'd actually learned to avoid sleeping in certain positions because of that dizziness that she had. In fact, she slept upright for a couple of years in a row, and she met a close associate of mine who referred her to see me, and she had a very common type of dizzy condition, which we were able to treat in the office that day, and actually we were able to remove her symptoms just with a few repositioning maneuvers in the office.